Hello, this is Dr. Gay from First Lake MRI, and this is a young athlete, a great soccer player, and they've had pain in their back and sciatic pain, and they're worried about a disc herniation or some other thing causing their pain. So they have a normal appearance of the lumbar spine. The vertebral bodies here, these squares are great. The discs, which are these little areas that are really bright in between, these are the cushions. They look fantastic, really nice. We see the white stuff back here. This is fluid in the spinal canal. We can see their nerves coming down here, and all their nerves look great. There's no pinching of nerves. And we can see these openings, the holes where the nerves come out. They look great. So the next thing we look for after we look at the vertebral bodies and the discs are these things called the posterior elements. The vertebral bodies are the front part, and then in the back here you have these spinous processes. Here, these big things in back. Here, 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 and they're joined together by these posterior elements that wrap around the right and left, and then they come together to form these spinous processes. So if we look off to the left-hand side, we can see them coming off here on the left. If we look on the right-hand side, we see them coming off on the right. And their problem is right down here, the right L5 vertebral body. If we go off towards the right and follow it backwards down to the posterior element here, we see this area that's brighter than everywhere else. See how nice and uniform this is? Fairly uniform. Right here there's a little dark notch, and that dark notch is a little stress fracture of the right pedicle. And if we window this up, you can see this halo of brightness. This is marrow edema, or just reaction of the bone around that little subtle stress fracture. So these are very hard to see sometimes. We have another sequence where it'll stand out a little bit better. In this view, we're looking straight at the patient, and we can see the spine here. We see the right side. This is a big muscle called the psoas muscle. Left side. If we go towards the back, we can see the left pedicle, right pedicle, and you can see how this right pedicle is really bright. So this is that fluid in the bone of the marrow edema associated with that right pedicle stress fracture. This is a fairly common injury in young high-level athletes, rowers and soccer players. All sorts of athletes get the same sort of abnormality from just too much stress back here. So stress fracture of the right L5 pedicle, and thank you very much.